you, sir. It gives me a lot of pleasure and happiness to be presenting in front of all the dignitaries here. So moving on from where sir had established very clearly the need of bringing something. So there was a need and sir had established it very well. So taking on from there, we understood that we have to bring a supportive program closer to every mother and her family, which is going to be useful and accessible to her in terms of awareness, care and support. And with that intention, Thunai set up a two-way approach where we went into the institution with the purpose of also first working with the mothers, the focus on the mothers with all sorts of interventions which are non-clinical, non-invasive, and also the focus on the nurse and the staff, the caregivers, the doctors, the healthcare providers, the nurses, the admin staff, who are also the first point in contact for every mother and family who walk into the institution. And we realized that appreciating their efforts into the system becomes primary when we are wanting to focus and target on mothers. So we have brought in a two-faced approach where we are able to target mothers by providing interventions like the one that you can see on the screen right now, practices, awareness programs and simple to-do flashcards flip book with the focus on the three aspects: awareness, care and support. And in terms of caregivers, we have been able to implement softening skills which have enabled them to warm up to the idea of empathy easily and also build in focus into care as an add-on to the wonderful work that they are already doing. And the institutions, of course, there have been roadblocks, there have been stumbling blocks, but we have also been welcomed with wonderful visionary institutions. Of course, Srishti is of course here, and we want to collaborate with other institutions who have the vision of directly providing care, support and awareness very close to home, and that's the focus. So as we talk about what we have been doing in terms of interventions and working with the mothers and the caregivers, we realize that there is also a great requirement of people who are professionally qualified to do so and build this, like they say, right, you need a village to raise a child, and having a mindful, professional village full of empathic people to provide that care, that focus, that support. That is the vision, of course, of the course. However, talking about the course gives me great pleasure because it is, of course, an idea that we had, way back. And I can see Dr. Subhashri and Ma'am Subhashri Ma'am nodding. And having an academic institution back us for this vision, understanding the professionality behind and the need for professionality behind is what was the pioneer for this course. The three pillars of the course is, of course, number one, the latest science and the evidence that is talking about the importance of perinatal health and its direct connection to the infant health. The unborn child in utero onwards is impacted by a mother's state of emotional well-being. And science says that if we start early, we can but establish a community of happy, resilient individuals. So the first aspect is, of course, the latest science that backs the theory or the idea that a community health is possible by simple awareness, simple support, simple care, very close to home for every mother and her family. The number two is, of course, bringing in culturally relevant practices. We have with us a toolkit that we have built. We are able to give it to our mothers and their families. Basic things, kolam, mandala, basic yogic posture, flow movements, nutrition, talking about the traditional aspects, right? We have a lot of practices where we talk about the valagappu and the different ways of doing valagappu, and then all of that. So bringing in culturally relevant practices closer to home therefore having more acceptance. And number 3, of course, the course itself provides the opportunity for the students to professionally learn by directly working with the mothers and their families. So the simulation per se is going to be under proper guidance and supervision, where they are going to be interacting directly with the mothers, of course under supervision and guidance, on how to spread awareness, care and support. Here is a brief course overview. Of course, Dr. VDS sir has already established a few points. I'm just going to quickly go through them, the important aspects. Number 1, this is a professional training, which means that there is going to be a whooping amount of virtual theoretical study, a lot of psychological concepts, a lot of developmental psychology, a lot of infant psychology, a lot of gender-based psychology, a lot of women's psychology, and so all of the 100 whooping hours of theory and 100 hours of experiential and practical, which is going to work in 2 schemas. The first one being dealing with their own self. The students are going to be working on themselves first, because an aware practitioner is the most focused practitioner. So the students are going to be encouraged by working with themselves, their own abilities, their own professional capabilities, and also a lot of time spent in the healthcare setting, where they are going to be working directly with the mothers and their families and so on. The second part is, there is equal importance, of course. There is 100 hours of classroom training and a 100 hours of direct experiential practical work as well. We also have a pool of globally acclaimed professionals and academicians, and they are going to be providing master classes. A little bit backstory is that the first interaction with the Madras School of Social Work was our faculty development program, wherein we got in the global pool of experts to do the training with the faculty, and may I say, what a wonderful, humbling experience it was. And of course, putting it together was no joke, but we made it happen, and that was in fact the start of what we are now calling as trained professionals, who are going to be supervisors for the students in the setting. So what do we do? After the students have professionally developed themselves, our vision, our hope, the institution and Thunai's hope is, of course, to see more and more hospital administrations, healthcare setups, public healthcare setups to be open to welcome these trained professionals into bringing in their expertise and their practice, because the focus remains only to bring care, support and awareness closest to a mother and her family. So we believe that the fertility treatment clinics and the healthcare settings are going to be the first wave to welcome the trained perinatal counselors. And for practitioners who are already in the field of psychology, this is going to be an add-on, because a niche is always looked up to in the field of psychology or in any helping professionals. Of course, there are stalwarts here, needless to say, right? So developing their own niche and working with the sex population is what we believe is the focus and the target of the course. And number 3, professionals such as nutritionists, doulas, birth educators, yoga experts, dancers, dance exercise experts like myself. So they also professionally develop their skills to build a niche into their work, making it more captivating, again, more available, more closer to home. Needless to say, no, they don't need an introduction. The program advisors that we have with us, of course, we have Dr. Subhashini here, Dr. Swaminathan sir here. We have one of our advisors is Dr. Najia Atif, who has trained all of the faculty members in the Madras School of Social Work in the FDP program in what is the Thinking Healthy program, a WHO endorsed manual which is loosely based on CBT, cognitive behavioral therapy, and has aspects from it making yet again access closer to home and providing support for a pregnant mother and her child and family. We also have Dr. Govind Krishnamurthy from Brisbane, a clinical psychologist from the University of Southern Queensland, and an industrial expert, Dr. Mahima Muralidharan, a clinical psychologist. Needless to say, they have all been the building brains. We have brainstormed with each of them hours and hours of brainstorm, and that's the product that we see today. So happy to bring it here. And the master class that we are talking, that I just talked about, the global experts, you would see Harita here and Dr. Anne Collin, who's from Yale, who's a dance and exercise exponent, and Harita, who's a childbirth and lactation educator, who has also been a part of the FDP program. And I'm happy to note and also let you know that the masterclass experts, we are still increasing, and the numbers of people pouring in even close to home like Nimhans and offering their support is very heartening, and we feel in gratitude, and also I'm happy to say that to you at this forum, at this launch. Lastly, what we would really like to see is to create empowered professionals in this field in order to develop the first league of professionals in the field of perinatal health. And these perinatal counselors will be the first league, will walk the path afresh. And of course, we need your blessing, your care, your support and your guidance as we progress along this path. Thank you very much. Thank you.